Hey everyone, welcome back to Speak Healthy. Today, we are going to discuss whether or not being African American increases your risk of having heart disease. Heart disease is a leading cause of death in the United States, and African Americans are disproportionately affected by this condition. According to the Centers of Disease Control and Prevention, African Americans are 20% more likely to die from heart disease than non-Hispanic whites. The reason for this disparity are complex, and researchers have been studying the relationship between race and heart disease for decades. In this video, we will explore the possible links between being African American and heart disease, including genetic, environmental, and socioeconomic factors. We will also examine the impact of cultural beliefs and attitudes on the prevention and treatment of heart disease in the African American community. By understanding the underlying causes of this disparity, we can work towards reducing the incidence of heart disease in African Americans and improving their overall health outcomes. Genetic factors have been suggested to play a role in the higher incidence of heart disease among African Americans. Researchers have found that African Americans are more likely to have high blood pressure, which is a major risk factor for heart disease. One study found that over 40% of African Americans have high blood pressure, compared to just over 27% of non-Hispanic whites. Research has identified several genes that may contribute to the higher risk of high blood pressure and heart disease in African Americans. For example, researchers have identified a gene called APOL1 that is more common in African Americans and has been linked to an increased risk of kidney disease and cardiovascular disease. Another gene called EDINRA has also been associated with higher blood pressure and an increased risk of heart disease in African Americans. However, while these genetic risk factors have been identified, it is important to note that they do not fully explain the disparities in heart disease incidence between African Americans and other racial and ethnic groups. Other factors such as environmental and socioeconomic factors may also play a significant role. Furthermore, genetic factors are not deterministic, meaning that just because someone has a genetic predisposition to heart disease, it does not necessarily mean they will develop the condition. Lifestyle factors such as diet, exercise, and smoking can also have a significant impact on the development of heart disease. Therefore, it is important to address both genetic and environmental factors in understanding the relationship between being African American and heart disease. Environmental factors are another important factor that can contribute to the increased risk of heart disease in African Americans. Exposure to air pollution, for example, has been linked to an increased risk of heart disease. Research has shown that African Americans are more likely to live in areas with high levels of air pollution, which could contribute to their increased risk of heart disease. Air pollution can contribute to the development of heart disease by increasing inflammation in the body, which can damage the blood vessels and lead to the buildup of plaque. Air pollution can also lead to oxidative stress, which can damage cells and contribute to the development of cardiovascular disease. Several studies have found that long-term exposure to air pollution is associated with an increased risk of heart disease and other cardiovascular conditions. The higher levels of air pollution in African American communities are often the result of structural inequalities. For example, African Americans are more likely to live in areas with high levels of industrial activity and traffic, which can lead to higher levels of air pollution. These neighborhoods may also have fewer green spaces and more environmental hazards, which can contribute to poor health outcomes. To address the impact of environmental factors on heart disease in African Americans, interventions may include reducing exposure to air pollution, promoting policies to reduce environmental hazards in minority communities, and increasing access to green spaces and public transportation. These interventions may also help to reduce the burden of heart disease in African Americans and promote better health outcomes. Socioeconomic factors are another critical aspect that can contribute to the risk of heart disease in African Americans. Poverty, limited access to healthcare, and other social determinants of health can all contribute to the development of heart disease and other chronic health conditions. African Americans are more likely to live in poverty than other racial and ethnic groups, which can impact their ability to access healthy foods, safe places to exercise, and quality health care. Poverty can also lead to chronic stress, which can increase the risk of heart disease. Chronic stress can contribute to the development of high blood pressure, inflammation, and other risk factors for heart disease. In addition to poverty, limited access to healthcare can also contribute to higher rates of heart disease among African Americans. African Americans are more likely to be uninsured or underinsured and may face barriers to accessing healthcare. This can lead to delays in receiving preventative care, managing chronic conditions like high blood pressure, and receiving timely treatment for heart disease. To address the impact of socioeconomic factors on heart disease in African Americans, interventions may include improving access to healthy foods, creating safe spaces for physical activity, and increasing access to quality healthcare. Community-based programs that focus on improving nutrition, providing exercise programs, and promoting regular checkups and screenings may also be effective in reducing the risk of heart disease. Addressing the root causes of poverty, such as investing in education and job training programs, may also help to reduce the disparities in heart disease incidence between African Americans and other racial and ethnic groups. Cultural beliefs and attitudes are an important factor that can contribute to the increased risk of heart disease in the African American community. Cultural values and beliefs can shape how individuals perceive health and healthcare and may influence their willingness to seek medical care and follow medical advice. For example, some African Americans may rely on traditional healers such as herbalists or spiritual leaders for their healthcare needs. Traditional healing practices may be deeply rooted in African American culture and may offer a sense of cultural identity and empowerment. However, relying solely on traditional healers may delay or prevent individuals from receiving timely medical care, which can increase the risk of heart disease. In addition to traditional healers, some African Americans may be less likely to seek medical care for their symptoms due to distrust or negative experiences with the healthcare system. This may be due in part to historical factors such as the Tuskegee syphilis study, which was conducted without informed consent on a group of African American men, leading to lasting mistrust of the healthcare system among African Americans. This mistrust may lead to delays in seeking medical care, which can result in untreated high blood pressure and other risk factors for heart disease. To address the impact of cultural beliefs and attitudes on heart disease in the African American community, it is important to engage with individuals and communities to understand their perspectives on health and healthcare. This may involve working with traditional healers to promote integrative medicine practices that complement medical care. It may also involve working to address systemic issues such as racism and discrimination within the healthcare system to build trust and improve access to quality care. Education and outreach programs that emphasize the importance of regular checkups and screenings for heart disease and other health conditions may also help to increase awareness and reduce disparities in health outcomes. Prevention and treatment are critical aspects of addressing heart disease in the African American community. Strategies to prevent and treat heart disease in African Americans need to be tailored to their unique risk factors and cultural beliefs to be most effective. Culturally tailored interventions are an important approach to address heart disease in the African American community. These interventions may involve the use of community health workers or other trained individuals who are familiar with the cultural beliefs and practices of the community. They may also involve adapting educational materials and messaging to be more culturally appropriate and understanding to the community. For example, a culturally tailored intervention may involve using the church as a platform to promote heart-healthy behaviors. Churches have traditionally played an important role in the African American communities and may be a trusted source of health information. A church-based intervention could involve offering healthy food options at church events, promoting physical activity through church-sponsored exercise programs, and providing educational materials on heart disease and its risk factors. In addition to culturally tailored interventions, strategies to prevent and treat heart disease in African Americans may also need to address structural barriers to care. These may include improving access to healthy foods, safe places to exercise, and quality health care. Policies to reduce air pollution and other environmental factors that increase the risk of heart disease may also be necessary. Addressing the unique risk factors and cultural beliefs of the African American community is critical to reducing disparities in heart disease incidence and improving health outcomes. By tailoring prevention and treatment strategies to the needs of this population, it may be possible to reduce the burden of heart disease in the African American community and improve overall health outcomes. Healthcare disparities are a significant issue that can impact the risk of heart disease in the African American community. African Americans may face a range of barriers accessing quality healthcare, which can affect their ability to prevent and manage heart disease. One of the key healthcare disparities facing African Americans is access to preventative care. Preventative care, such as regular checkups and screenings, is critical for identifying and managing risk factors for heart disease, such as high blood pressure and high cholesterol. However, African Americans are less likely to receive preventative care than white Americans, which can contribute to higher rates of heart disease and other health problems. Discrimination is another healthcare disparity that can impact the risk of heart disease in the African American community. Studies have shown that African Americans may be less likely to seek medical care due to experiences of discrimination, which can result in delayed diagnosis and treatment of heart disease. Discrimination can also affect the quality of care that African Americans receive when they do seek medical care, leading to suboptimal management of their heart disease and increased risk of complications. Improving access to quality healthcare is essential for addressing the healthcare disparities and reducing the risk of heart disease in the African American community. This may involve increasing the availability of preventative care services such as regular health checkups and screenings, and implementing programs for improve the management of chronic conditions such as heart disease. Healthcare providers can also work to address discrimination and bias in their practices by adopting culturally sensitive approaches to care and actively working to address disparities in healthcare outcomes. In addition, addressing social determinants of health, such as poverty and limited access to healthy foods and safe places to exercise, can also help to reduce healthcare disparities and improve overall health outcomes in the African American community. By working to address healthcare disparities and social determinants of health, it may be possible to reduce the burden of heart disease in the African American community and improve overall health outcomes. Policy interventions can be crucial in reducing the incidence of heart disease among African Americans. Policymakers and public health officials can play a critical role in addressing social determinants of health, such as poverty, limited access to health care, and other environmental factors that contribute to the increased risk of heart disease in this population. One key policy intervention that can help address social determinants of health is to increase access to health care for African Americans. This may involve expanding access to affordable health insurance, implementing policies to reduce discrimination and bias in healthcare, and increasing the availability of preventative care services. Policies that promote the use of evidence-based treatments for heart disease can also improve outcomes for African Americans with this condition. Another policy implication is to address poverty and other environmental factors that contribute to the increased risk of heart disease among African Americans. This may involve implementing policies to increase access to healthy foods and safe places to exercise, as well as policies to reduce exposure to air pollution and other environmental toxins that can contribute to heart disease. Public health officials can also play a role in increasing awareness of the risk factors of heart disease among African Americans. This may involve developing culturally tailored public health campaigns to educate African Americans about the importance of a healthy diet, regular exercise, and the importance of early detection and treatment for heart disease. Heart disease is a significant health concern for African Americans who are at increased risk for developing this condition. The risk factors for heart disease in this population are multifaceted and can include genetic, environmental, cultural, and socio-economic factors. These factors contribute to disparities in heart disease incidence and outcomes between African Americans and other racial and ethnic groups. Preventing and treating heart disease in African Americans will require a comprehensive approach that takes into account the unique risk factors and cultural beliefs in this population. This may involve implementing policies to reduce healthcare disparities, and address social determinants of health, as well as developing culturally tailored interventions that meet the specific needs and concerns of African Americans. While there is still much to learn about the complex relationship between African American identity and heart disease, it is clear that addressing this issue is an important public health priority. By working to reduce the incidence of heart disease in African Americans, we can help to improve the overall health and well-being of this community and reduce health disparities in the United States as a whole.